your name and your
Okay,
position.
hi, my name is
Okay.
Dr. Muhammad Iqbal bin Abdul Hafiz. I am a nephrologist, so I'm a kidney doctor. So with regards to your topic, I think there are a lot of misconceptions. Number one, which I may try and clear up today. Number one is medications that you think that can cause, that are perceived to cause renal failure or damage to your kidneys. And number two, I'd also like to talk about specifically medicines like what like direct selling medications, or what we call supplement to some direct selling medications, traditional medications, so these are the two concepts that you need to understand. So anyway, if you're talking about medicine in general, of course there are side effects to every medication, and some of these are not known until the patient takes it, alright? But so if you're asking, for example, simple gout medication can cause a severe allergic reaction. Okay. Medicines such as allopurinol, I'm not sure you've heard of that. Okay, so that can cause a simple allergic reaction. But the problem is, what the certain medication can also cause direct kidney injury, right? So these are the most common one. It can cause a direct injury to the kidneys, the tubules you call it, or it can also cause injury via a sort of an allergic reaction. Okay, this is called a state called acute interstitial nephritis. Okay, so there are certain medications, like I said, that can cause direct injury to the kidneys. And number one, the most common one is of course your painkillers.
Yes.
It's called a non-steroidal anti-inflammatory, and these are things like commonly called Ponstan, Voltaren. Okay, these can cause direct injury to the kidney. Whereas there are certain medications like antibiotics. There are certain types of gastric medications that can cause a type of an allergic reaction, which can cause damage to the kidney as well. Okay, sometimes it's like there are certain patients who are at risk of getting injury to the kidneys or damage to the kidneys, and for example, in patients who have already a kidney disease called chronic kidney disease, if you give them, they are not allowed to take certain medication, especially like your what you call it, your painkillers. Paracetamol is safe, your Panadol is safe, but things like Ponstan, Voltaren, ibuprofen, and all this one can cause damage to the kidneys if you take it regularly. Even a patient without any kidney disease, if you take it regularly, like every day, for example, it will cause kidney damage. Certain antibiotics can cause this allergic reaction. Sometimes we can't tell, but usually you'd ask them whether they have any allergic to antibiotics, or whether they have a history of allergies. This can cause kidney damage. Okay, so that's in general. So, but there is a misconception that so for example, certain people, they're on a lot of medications. Okay, it is a misconception if you think that you're taking like 5 or 6 types of different medication altogether, it can cause kidney damage, for example. This is an absolute misconception. There's a difference there, because the damage happens, for example, so what damages the kidney is actually the root of the problem is the diabetes and the hypertension. So if you don't take your medicine to control your diabetes and hypertension, then your kidney will be damaged and cause chronic kidney disease. You understand?
Yes.
Rather than the other way around. People say, oh, I'm taking too much medicine for my blood pressure, I'm taking 3 types of medicine for this, 3 types of medicine for my blood pressure, 3 types of medicine for my hypertension, cholesterol, and this collectively does not cause kidney damage. Okay, so
doctor, can you talk a little bit about herbal supplements?
Okay.
And if patient takes it together with the prescribed ones?
Okay, usually we don't encourage things like traditional medicine, herbal supplements, because number one, we do not know what the content of the pill is, you see. So the difference between like the herbal supplements or things that are, and the normal medications that you take from the hospital is the hospital from the medicine from the hospitals are actually put through a rigorous test to see whether they're safe or not, you see. So they are tested on scientifically in a large population to see whether they're safe, you see. And if they are not safe, through these clinical trials, to this rigorous test, then they will be withdrawn. Whereas eating a pill, for example, herbal medicine is just as safe as you blending a very concentrated type of leaf, for example, and putting into a pill. So you don't know the content of what's in there, and whether this high amount of concentration of these herbs can causes damage to the kidney or not. But herbal. But we have seen many cases. In fact, about 20%, about 15% of end-stage renal failure patients or patients who develop kegagalan buah pinggang is actually due to this herbal medicine, especially in Asian countries like Malaysia. Okay.
Doctor, so about the are there any like treatments when patient comes with like intoxication?
There are
or signs of renal damage?
Yes, there are, of course. If you have renal damage, then if it's very bad renal damage, and then you may have to undergo dialysis. Okay, especially if the toxic is still there, then dialysis may also help in removing these toxins. Okay, but that is usually in the case of where the patient suddenly took an overdose or it's a sudden poisoning. Okay, but if you've been taking this for a long time, you cannot reverse this, and if you do need dialysis, it's going to be lifelong. Okay.
So are there any like advice to the public about herbal supplements?
Yep. So advice to the public is you have to check with your doctors to see whether the supplements are actually safe. There are some supplements, for example, I must admit that's safe. For example, fish oil or omega pills, omega-3 pills. These are safe, but certain things that are made of herbs or plants, you may need to refer to your doctor first. Okay.
So doctor, do you want to continue the renal transplant topic? Or?
Okay, first, renal transplant is an option for patients who suffer from end-stage renal failure. Usually they have three options, which is your hemodialysis, your peritoneal dialysis, and also your kidney transplantation. However, kidney transplantation in Malaysia is the prevalence is still low, and there are many factors to this, including lack of surgeons, lack of specialists. So patients end up not having transplant at all, and just continue with dialysis. Kidney transplantation is the best form of treatment for patients with end-stage renal failure, if they are well, of course. That means there are a criteria to have to meet first if you want to undergo renal transplantation. That means, for example, you cannot have severe heart disease, for example. You cannot have certain infections, for example. So not all can undergo that transplant. But yeah, so however, the opportunities for renal transplantation is very low in this country, okay, because not many centers do it.
Okay. So doctor, what's your opinion about patients going overseas to get organs and they buy from overseas?
Okay, unfortunately this is not allowed in our country, but saying that because people can get desperate, so they go to countries like China, they go to Bangladesh, India, to get transplantation, and this is done in a very risky way. It's very expensive. It can cost up to $500,000, and usually these transplantations are done in not a proper way. I mean, it's illegal. They don't have identities, and once they're done, they just send them straight back on the plane back to us to manage. So, and in terms of law, this is illegal. So, however, as I said, a lot of people still go there because they are desperate for kidney transplantation. That means they do not want to go on dialysis.
So, can you talk a little bit about the procedure, how it's like? Do they need to administer any medication before that or after the surgery? Yeah.
Okay, so usually what we'll have to do is, because you get an organ from another person, the patient will have to take medications called immunosuppressions, and they are taken after you've done the operation. On the day of operation, you are given certain types of medication for immunosuppression, and the person who receives the transplant will have to be on immunosuppression for life. Okay, and this is to avoid a rejection from happening, rejection of the new kidney from happening.
Okay.
Okay.
Anything else you want to add about renal transplant?
Okay, so I think if it's a new patient who has got end-stage renal failure, for example, try and pursue a transplantation, and try to seek advice, because there are only a few centers that does transplant in Malaysia. This includes HKL, Selayang Hospital Selayang, and UiTM. So you may see what's going on there.
Yeah. Any tips to the public?
Any tips to the public?
Yeah, about kidney.
You have to get your final word is basically yes, get yourself screened, especially if you're above 40 years old, because studies have shown that in Malaysia about 10% of adults have kidney disease. So usually diabetes and hypertension causes not only causes heart disease, stroke, but also causes kidney disease. So if you have this, you have to screen yourself at least once a year. And what you do is you just check a blood test, a simple blood test, which checks your kidney function, as well as your urine test, which checks for any protein or any blood in your urine. So get yourself screened.
Okay.